Today we're going to be doing palpations on the tibial tuberosity and the greater trochanter. So first, for the tibial tuberosity, I have my patient in the seated position, relaxed. You're going to find the patella, and then you're going to move inferior, a little bit down. And then when you feel like a little notch, like if it's right about here, that's going to be a tibial tuberosity. And then now I'm going to have them laying down in the sideline position. Actually, I'm going to have them in this bag. So I have my patient maybe lay at a 90-degree angle, like so. I'm going to do a little bit of external rotation of the hip. Bring it inwards. I'm going to feel for that pulling right about here, right below the hip. And yeah, that's how you find a greater trochanter.
Today we'll be doing some palpations on the upper leg. First, we're going to start with finding the vastus lateralis. So basically, I'm going to have my patient try to keep their legs straight and basically contract their quad. They're going to look for that lateral quadricep muscle right around here, and it should insert right about there, so just follow it up. And that'll be your vastus lateralis. Next, we're going to do the medial condyle. So you want to come over to the side. You push it like that for me. You want to find right by that patella. You want to go off to the medial side and then go up a little bit. And you should feel a little space right beside that patella, and that's going to be where your medial condyle is for the femur. Next, we're going to have them find the gracilis. So can I have you just try to like bring this leg up over this one, like this. This one is going to be harder to separate from the other muscles, but you know it should be on that medial side of that thigh. It's going to be a little muscle that should run all the way up to about their hip. It's going to be run through the whole side of it right there.
All right, so today we're going to be doing the range of motion test on hip internal rotation. So first, we're going to be going goniometer. You want your stationary arm placed right perpendicular to the floor on the shin or the tibia, and you want the fulcrum to be like right below the patella. So I want to have my patient try and bring his foot outside, so I move it laterally. So go ahead and bring your foot out. As he's moving his leg outwards, I'm going to move my arm. Make sure to keep that stationary arm perpendicular to the floor. And we're at about 29 degrees of internal rotation.
All right, so today we'll be doing range of motion. First, we're going to start off with knee flexion. So for knee flexion, we're going to put that fulcrum right on that lateral condyle. We're going to put the stationary arm going towards the hip. We're going to put the movement arm going towards the feet. So basically what we're going to have them do, we're going to have the patient take that knee and try to bend it as far in as they can. All right, so we get that number, we have about 130 degrees of knee flexion. All right, so the next range of motion we'll be doing is hip flexion. We put the fulcrum at this lateral condyle. We get the movement arm facing towards their feet. We're gonna have them come, bring their knee up. Then we're gonna have them try to bring it all the way down to their chest. See how far they can go. For this one, we have about 115 degrees of hip flexion.
Today we're going to be doing a range of motion test on hip adduction or adduction. So right now I have my patient sitting up with one leg straight on the table and the other leg hanging off. So I'm going to grab my goniometer. I'm going to place it parallel with the femur and the tibia with his leg. And I'm going to have him bring his foot as close as he can immediately towards the other leg. So go ahead and bring it in for me. As he's moving, I'm going to move my movement arm. And we are at about We're at about 12 degrees of hip adduction. A manual muscle test on the bicep femoris. So right now I have my patient lying in a prone position, so on their stomach. And now I want to have them try to bring their heel towards their butt. Automatically when you do that at grade 3. So now I'm going to try to, I'm going to hold down on his pelvis, and I'm going to have him try to resist my hand from pushing his foot down. So go ahead and bring it up for me. All right, now his grade's at a 4. Now I'm going to try one more time with more resistance. So go ahead and bring it up for me. All right, so now he's at a 5.
We'll be doing a manual muscle test of the glute med and the glute min. So basically I'm gonna have my patient bring his top foot a little bit in front of the other foot. And I'm gonna have him just try to raise that foot to the sky. All right. If they can do that, that automatically puts them at a 3. Now I'm gonna put my left hand right above their hip and put my right hand at their knee and apply a little bit of resistance. And you lay up. All right, like that. If they can do that, that puts them at a 4. And for the next one, I'm gonna put my left hand back on the hip and I'm gonna put my right hand about right above their ankle. I'm gonna have to lift this guy again. And come back down. Now they can do both of those, that puts them at a 5.
So today I'm gonna have my patient try to stretch their semimembranosus muscle. So I'm gonna have them try to get in a squatted position. All right, I want them to take one of their legs and I want them to try to extend it outwards. I want you to try and like lean your body into your heel, try to grab your other foot and feel that stretch right there on your medial side. All right, you can come back up now.
All right, so today we'll be stretching the glute med and minimum. So basically what I'm gonna have them do is I'm gonna have them bring this knee up. I'm gonna have them take this leg and put it over this knee right here. Then I'm gonna have them use their hands, reach behind the thigh, and I'm gonna have them pull it back towards them. And they should feel the stretch all around here, stretching that gluteus minimus and gluteus medius.